Welcome! Let's talk about how to manage pain at home following joint replacement surgery. The nurse will go over specific instructions before you leave the hospital, and general information is in the handbook. It is important to understand feeling pain is normal and part of the healing process. So expect pain, especially during the first few weeks after surgery. Remember, surgery pain is temporary and will get better as you heal. Don't wait for pain levels to escalate. Find ways to relieve the pain when it starts to feel worse. Taking prescription narcotics will probably be necessary around the clock for a few days, with the goal of eliminating within a week or two after surgery. Don't go cold turkey. Gradually decrease the amount and how often prescriptions are taken over a few days. Either progressively increase the time in between doses by an hour or two, cut pills in half, or substitute with Tylenol, otherwise known as acetaminophen, for pain. Gradually decreasing before stopping completely will prevent complications related to dependency. For most patients, the hospital prescription will be enough. If a refill is necessary, plan ahead and call at least 2 days before more medication is needed. Remember to limit the total amount of Tylenol to 3,000 milligrams a day to avoid liver damage. Some narcotics contain Tylenol, so be sure to read the label and include that number in the total amount given. All medications have the potential for side effects, including dizziness, nausea, and constipation, which is the most common side effect. We recommend Miralax or milk of magnesia to soften stools while on prescription pain medication. Be sure to have one of these over-the-counter laxatives at home and take it every day until bowel movements are normal. Call the surgeon's office if it's been longer than 3 days between bowel movements. Even though decreased appetite is common during the first few weeks after surgery, a good diet and drinking plenty of water is essential. All pain meds should be taken with food or milk, especially during the night. Increasing the amount of fiber and fluids helps keep digestion moving. For an extra dose of fiber, check out the easy recipe in the handbook for BAP, bran, applesauce, and prune juice. Here's a tip. Freeze BAP in an ice cube tray. 1 cube equals 1 serving size. Medication is just one part of pain management. Other techniques are recommended. Try deep breathing through the pain. Avoid thinking about it by watching TV, reading a book, or playing board games. Distractions are helpful, and so is changing positions. Readjust while seated or lying down to avoid stiffness that leads to pain. Remember, for a new knee, never put a pillow under the bend of the leg. You might notice some swelling around the new joint, and that's normal. Take home the hospital gel packs found in the freezer to use with the wrap. And remember the acronym RICE. R is for rest to control swelling and pain associated with overdoing activity. Other than exercises and walks recommended by your doctor, you should be resting. For swelling, remember I. For ice, apply ice using 2 of the frozen gel packs for the first 2 to 4 weeks. Keep the other 2 gel packs in the freezer so they're always ready to go, and switch them out every 3 to 4 hours. You can machine wash and air dry the wraps. C is for compression. Wrapping the gel pack snugly helps with swelling. And E is elevate the joint. For those with a new hip, you may place pillows under the foot or leg if there's swelling. For a new knee, put the wedge under the entire leg to keep the replacement knee straight. Use as often as tolerated for the first 2 weeks. Keep the guide to recovery in a handy location and refer to it often. Always call the surgeon first with any questions or concern related to joint replacement. Remember, the surgeon is your partner in care. Don't hesitate to call. When you call, the surgeon may recommend a visit to an orthopedic urgent care location, which is preferred over the ER because it is less expensive and limits exposure to germs. If an ER visit is necessary, don't forget to take the joint replacement card with you. If the situation is life-threatening, call 911. Please watch the other joint replacement videos for additional information. Recovery is a process. Be engaged and take care of yourself every step of the way. Let's keep moving. After a joint replacement, there are some do's and don'ts. The therapist will go over specific instructions before you leave the hospital, and general information is in the handbook. First, a few don'ts. For the first 2 weeks, no driving. Typically, there's an appointment with a surgeon around 2 weeks after surgery, and you can talk about driving readiness and return to work. Even if the surgery is on the left leg, driving is a risk, especially while on prescription pain medication. Don't lift anything over 50 pounds on a routine basis ever again. Joints wear out more quickly with excessive lifting of heavy weights. This may include pets and grandchildren. That doesn't mean no activity. Take it slow and steady and do the recommended exercises. Some surgeons prescribe home health physical therapy or outpatient PT. Talk to your therapist about a gradual return to using equipment in a gym facility or at home. The surgeon may prescribe precautions depending on the joint and type of procedure. For those with a new knee, don't place a pillow directly underneath the bend. It might temporarily provide comfort, but when the knee stays bent over extended periods of time, scar tissue forms so the leg may never fully straighten, which will affect walking and standing. Place the wedge under the leg to keep the knee straight. Use the wedge as much as tolerated while at rest for the first 2 weeks after surgery. For some, it's all night. For others, it might be 30 minutes at a time. For those with a new hip, the precautions prescribed by the surgeon vary, and some patients will not have restrictions in movement. If there are hip precautions, the therapist will review these before discharge. Now let's move on to what to do, how to get the home ready, and how to be safe during recovery. Do make sure all the pathways are clear, remove rugs, cords, anything that might get in the way of going to the bathroom, bedroom, or kitchen. Plug in night lights to illuminate the path. Keep the most used items at waist level, nearby, to avoid overreaching, twisting, or falling. Take extra time for everyday tasks like getting out of bed, dressing, or taking a shower. Rushing affects balance. So does mixing alcohol with prescription pain meds. Keep pets in another room or restrained if they like to jump up when excited or run around. Preventing falls is really important. If a walker or crutches are used in the hospital, use at home for at least the first 2 weeks. Support may be necessary when using the stairs. The person helping stays on the stairs below the patient. Then it's up with the good leg and down with the bad. While going upstairs, lead with the non-surgical leg, and going down, start with the joint replacement. Any and every time there's a fall, call the surgeon. Even if it seems like it's not a big deal, every fall is a risk for complications that may go undetected if the surgeon is unaware. Keep the guide to recovery in a handy location and refer to it often. Always call the surgeon first with any questions or concern related to joint replacement. Remember, the surgeon is your partner in care. Don't hesitate to call. When you call, the surgeon may recommend a visit to an orthopedic urgent care location, which is preferred over the ER because it is less expensive and limits exposure to germs. If an ER visit is necessary, don't forget to take the joint replacement card with you. If the situation is life-threatening, call 911. Please watch the other joint replacement videos for additional information. Recovery is a process. Be engaged and take care of yourself every step of the way. Thanks for watching. This video covers preventing infection and blood clots after a joint replacement. The nurse will go over specific instructions before you leave the hospital, and general information is in the handbook. Preventing infection is really important. Hand washing is the best way to prevent an infection from spreading, so make sure everybody keeps their hands clean. It is also important to keep clean sheets on the bed, wear clean pajamas, and make sure pets stay off the bed while an incision is healing. All patients have a silver occlusive dressing covering their incision. It is designed to kill bacteria. The dressing typically comes off 7 days after surgery. Specific instructions are in the paperwork to take home. go ahead and shower with the dressing on. It's water resistant, so it can get wet as long as the edges are well stuck to the skin. Do not completely submerge the incision underwater, so no baths, pools, lakes, or hot tubs. If the dressing becomes loose or the tape starts peeling on the edges, remove the dressing. When water reaches the incision, the dressing is not working, so it's time to take it off. Cover the incision with gauze and paper tape from the local pharmacy if the incision is draining. Otherwise, leave the incision exposed. Don't apply any type of cream, lotion, or ointment on the incision. Shower as normal, rinse well, and pat dry. Talking about hygiene, a few reminders on dental health. Avoid routine visits to the dentist for at least 6 weeks following surgery. Call the dentist right away for mouth pain or if you suspect tooth infection. Most patients don't require antibiotics before dental work after a joint replacement. Your surgeon or your dentist will prescribe antibiotics if necessary. In addition to infections, the other potential risk following surgery is a blood clot. There are 2 ways to prevent clots: moving and medication. The goal is to move every hour or 2 while awake. A short walk to the bathroom or to the kitchen is enough. If you need motivation, set your oven timer as a reminder. Gradually increase the distance and use a walker or crutches until cleared by your surgeon. While sitting, do ankle pumps 10 times every hour. Avoid long car or plane rides for 3 to 4 weeks after surgery. If you do travel, step every 1 to 2 hours to move around or at least stand up. Some patients need to wear compression socks for several weeks to help avoid swelling and blood clots. If necessary, specific instructions and an extra pair of socks will be sent home with you. That covers movement. Now let's talk about medications to prevent blood clots. All patients will be on a blood thinner at home. For most patients, it will be aspirin, but some will need a prescription blood thinning medication. Aspirin after surgery is used as a blood thinner, not for pain, so don't stop taking it when you stop taking prescription pain medications. Typically, aspirin is taken for 4 to 6 weeks after surgery, so you'll take it much longer than your pain medication. Don't take over-the-counter anti-inflammatories such as ibuprofen or Aleve while on your blood thinner. Only take anti-inflammatories prescribed by the surgeon. While on a blood thinner, don't take fish oils or herbal supplements because they will thin the blood beyond what the surgeon recommends. Finally, if you smoke, quit. Smoking increases your risk for developing an infection. Keep the Guide to Recovery in a handy location and refer to it often. Always call the surgeon first with any questions or concern related to joint replacement. Remember, the surgeon is your partner in care. Don't hesitate to call. When you call, the surgeon may recommend a visit to an orthopedic urgent care location, which is preferred over the ER because it is less expensive and limits exposure to germs. If an ER visit is necessary, don't forget to take the joint replacement card with you. If the situation is life-threatening, call 911. Please watch the other joint replacement videos for additional information. Recovery is a process. Be engaged and take care of yourself every step of the way.
Did you know more people in Michigan die from opioid overdose than traffic fatalities or gun violence? In the last 5 years, the number of opioid deaths in Michigan has more than doubled. At Spectrum Health, our goal is safe and effective care and to help end the opioid epidemic. So it's important to understand what you've been prescribed. An opioid is a narcotic. It's the medication you may need to manage your pain for a short period of time so you can do the things you need to while you heal. While certain types of pain are normal, everyone feels pain differently. You may benefit from applying ice or heat, meditating, or using distraction techniques. Because of the potential for opioid addiction, there are precautions we'll take and ask you to follow. We'll prescribe the lowest effective dose of opioids to manage pain. Never take opioids in higher amounts or more often than prescribed. Do not combine opioids with alcohol or other drugs that cause drowsiness. Your prescription will be limited. 3 days is usually enough for most acute conditions. We recommend you decrease your opioid use as soon as possible. Most patients tell us they use less than half of the pills prescribed, and some do not use any. Check with your insurance and your pharmacy to understand your prescription coverage and any new policies related to opioids. Follow up with your prescriber if your pain is not decreasing as expected after you leave the hospital. This may be a sign that you need to be evaluated by your care team. To confirm we've covered the risks of using an opioid, we'll ask you to review and sign the Opioid Start Talking form required by law. Finally, it's important to safely store and dispose of your opioids. Store in a secure and out-of-reach place. Never share prescription opioids. Only take an opioid as prescribed. For example, don't take it for a headache if it was prescribed for back pain. Dispose of unused opioids in one of 2 ways. Take to a designated drop-off in your community. Or mix, don't crush, drugs with used coffee grounds or cat litter in a plastic bag, then throw away. You are the most important person on your healthcare team, so please do not hesitate to ask questions. We're here to help you manage your pain in the safest and most effective way possible.